Come with me to Guatemala as we go on a surgical mission trip, and I'll show you the fascinating and interesting differences between Guatemala and the US that we noticed. First up, we have pap smears. Once you remove the slide from the reused formula bottle, after it's soaked in alcohol, the specimen is fixated with hairspray and placed back in and sent to the lab. Here we used a bandage to help fix the operating table so it wouldn't fall apart on the bottom. This old jug was used as a sharps container holding needles and blades. This is the hospital hallway where the bathroom toilet paper is on the wall. Make sure you get enough. Any container that can be found is used for pathology specimens. Patients shared one room with about 10 beds in the room, and for some reason they would move the patients around every morning. It was hard to keep up sometimes. These are stirrups we had to attach using zip ties. This is how they look when they're in use. Besides a fly swatter in the OR, we found geckos and lizards on the wall. Here we are. Instead of SCDs, we used ACE bandage wraps as compression. We reused Bovie grounding pads as much as possible. We also only had 3 scrub brushes for the whole week, so it was soaked in an antiseptic and we could reuse them each time we scrubbed in. This is an antiseptic that we used for sterilizing certain areas, and anesthesia used this every time they placed a spinal. Also notice the minimal supplies used to place a spinal. Let me know what you thought about Guatemala versus the US.